3 years ago, Kevin Torrance would have described himself as active, gregarious and a social butterfly. But a sudden injury changed everything.
I'll never forget it. I got up to go to work and I heard a noise, and the next thing I knew, I was down on the floor in the room. The pain was overwhelming. A couple of discs had come out of place, and as it turned out, they'd impinged on my sciatic nerve. I've had back problems for a long time, and I thought, well, it'll be okay. But it wasn't. It's never got better, and if anything, it's progressively got worse.
Kevin previously walked 100 miles every week, but now struggles even getting around the house. And his job as an area manager, which he loves, has been severely impacted too.
Sciatic pain is predominantly like an electric shock going down your leg, and you're in the middle of a business meeting with people, and you could be discussing contracts worth lots of money, and all of a sudden you let out a yelp. It's not a good look.
Kevin had little understanding of chronic pain before his injury.
It's even hard to imagine when you're not in that position to try and say, imagine being sore all the time. And I mentioned if you were to kick the bed with your toe in the morning, it's brutal. But it's 10 minutes, so wow, I'll not do that again. Can you just imagine that staying that way forever?
Chronic pain is defined as pain lasting more than 3 months. It can be caused by an injury, like in Kevin's case, or another condition like arthritis. But in some cases, there's no clear physical cause, and the pain can be as a result of psychological trauma or stress. How much of a support have your family been throughout all of this?
Don't know if I'd be here without them. Linda's a nurse and she's been pivotal in me getting to this point. She's to help me get dressed in the morning, help me get washed, help me get ready to go to bed. That can't be fun. There's 3 boys and a girl, and they have all helped in their own way. They would do anything for me, as I would do for them still. But again, they don't quite understand. It's changed my character. I'm definitely not as outgoing as I was. I'm not as gregarious as I used to be. Because it's awful difficult to be fun when you're sore.
Kevin says his doctors and nurses have been great, but there's only so much they can do for an injury like his. The mental impact of that has been just as tough, if not harder, to come to terms with.
I was that desperate that I actually asked him, what if I get my leg took off? Would that help? And he said, no, it's not going to help you. You know, but that's how drastic it was for me. If somebody had said to me, if you get your leg took off, then that pain will go. I'd do it now. That's drastic. But when you're living with pain, that's what it does to you. That was a pivotal day for me as well. I was really upset when I came out of there. Grown up guy, you're not meant to be crying like that, but it was despair.
The number of people living with chronic pain in Scotland is on the rise. Studies have shown that in the most deprived parts of the country, as many as 1 in 2 people are affected. And it's not much better in affluent areas, where chronic pain is thought to impact around 1 in 3. For GPs like Dr. David Blaine, who's based in the north of Glasgow, it's presenting a particular challenge.
It's one of the most complex things we deal with, and no 2 people with chronic pain are the same. So you have to tailor the response. You have to, first of all, make the correct diagnosis, and that can be challenging. And then you've got to try and work out what the best supports might be. And usually it's not one thing. There's usually multiple things that could help.
David says despite chronic pain being more common in areas like his, that doesn't necessarily translate into more resources.
There is a bit of a postcode lottery in terms of pain supports. There's some health boards that have good multidisciplinary services. Again, I would argue we need to have more of them closer to people's where they live in communities, more in primary care as well. But there's some health boards that don't have that level of service there. So there's definitely lots more that can be done.
How confident do you feel that those changes will get made?
I'm hopeful. I think we have, across the Scottish NHS, there is a growing understanding of the complexity of chronic pain, but also how common it is and how disabling it is, and we need to do better. There's lots and lots of other people probably in your local area who are living with pain. The potential for better support is definitely there.
The Public Health Minister, Jenny Minto, told us she's determined to improve care and support for people with chronic pain. She says she's working closely with health boards to improve how services are accessed and delivered. Eventually, Kevin's GP referred him to a pain management programme. It supports patients with medication and mobility, but also focuses on techniques like mindfulness. Kevin says getting peer support was invaluable.
I think we were all happy to meet someone else in the same boat. As silly as that sounds, it was nice to meet someone who did understand the memory loss, the fragility of the whole thing, and just having their lives that they knew before their injuries taken away.
Physiotherapist Cassandra MacGregor runs a pain clinic in Lanarkshire and has helped to support Kevin. She says getting patients to accept their chronic pain can be one of the biggest challenges.
Often by the time that people will come to see me, they'll have been to different parts of the health service. They may have had different messages, they might have tried different things, they may have been looking for specific answers or diagnoses, they may have been hoping naturally that the pain will resolve. So often I have to help people to kind of understand what chronic pain is and help people in a way to come to terms with it being there and with the nature of this condition.
Cassandra agrees it's tough for the already stretched NHS to meet the needs of patients.
It's realising that you do need to build up that relationship first of all, and so often people need to feel heard, so they need to know that you understand what's going on. So assessment can take 2 or 3 sessions, so it can take quite a lot of time. I guess I worry that as services become more stretched and chronic pain becomes more prevalent and multiple long-term conditions is a significant issue as well. So I guess I worry that people fall through the gaps, that services seek to be more exclusionary.
One person who knows just how beneficial the right support can be is Marie McNicol.
So what time were you home at the day then?
2, we're back about 2.
She has arthritis and has lived in pain for most of her adult life. Around 10 years ago, Marie paid for a private scan, which showed 3 vertebrae at the bottom of her spine were wearing away.
I always worked in pubs and restaurants and full of life sort of thing. But I think by the time I was in my early 50s, I was absolutely washed out. I was struggling with everything. I had 2 sticks at the time, and I didn't want to go out with sticks as well, so it got to the stage I pretty much didn't go anywhere for a long, long time, so that was horrible. I actually burst out crying in the doctors one day as well and said to her, look, I cannot cope with this another minute. I really can't.
Marie was diagnosed with chronic pain syndrome after being referred to Cassandra's clinic. She says speaking to people who understood her pain felt validating.
It was like a world of knowledge. And just saying, to take a minute, even if it's just to get your breathing under control, get yourself steadied down so you're not sitting all shaky and things like that. Learning all the different tactics was really good as well. And it's things that I still use now, and they definitely help me.
You said you had to give up work when things got really bad for you. What did you find it like engaging with the benefit system for the first time?
3 days in a trot, 2 hours on the phone to a guy who worked for them, who was fantastically helping me. But sitting there for that length of time, trying to write things in, that was a nightmare, an absolute nightmare.
Cassandra says that's a common challenge for people she supports.
We're kind of at this point with benefits and with people with long-term conditions and with workplaces where it's not all fitting together, and health inequalities are so large in Scotland, that some people are just simply getting too ill to work before they reach the sort of state pension age. So we drastically need to tackle inequalities, but we also need the benefit system to be more flexible.
How much of a difference do you see in your patients from the first time they walk in your door to even say 5 or 10 sessions down the line?
Marie is a good example of this. So if somebody's limping and they're struggling to walk, sometimes if they've not really come to terms with what's going on, they don't want to use the walking aid because that means that they're old before their time or that they see themselves as disabled. And so even after 4 or 5 sessions, if somebody is using a walking aid, to me it shows that they've kind of moved forwards a little bit and they're walking well with it.
Thanks to that help, Marie now manages to get out of the house more often. And one of the highlights of her week is heading along to a local community group.
when I started doing it at first, I thought it'll take me a year to pick anything up, but it didn't really matter. It wasn't really just about the sewing, it was to do with like speaking to other people, like listening to their wee stories, whether it's to do with their family or anything, just socially being involved with other people again was really good.
Cassandra says giving people back a sense of independence is often one of the most important parts of managing chronic pain.
People often describe that they feel a bit more like themselves. Their mood is a bit better, they maybe feel more confident to have chronic pain, to live with chronic pain, to move, to kind of engage in stuff. But sometimes it's about readdressing priorities. So perhaps realising that you can't do everything that you used to do, and so priorities need to change.
As the number of people living with chronic pain continues to rise, it's going to become even more important for them and society to adapt.
I mean, I'm not anywhere near where I was before. I knew, like, when I was younger or anything, like, I'm not, but at least I'm still doing things now. I still can get up and go, and slowly, but like, I've got it in my heart that I want to do, that I do want to do things.
So important to find enjoyment in the things that you can do.
Definitely.